I'm Kelley Holman,
And I'm Nicole Staley.
and we have the drug Alteplase. Its class is a thrombolytic, and it decreases blood clotting properties. So, for this drug, it's indicated for the treatment of acute ischemic stroke, and you begin treatment as soon as possible within 3 hours after symptom onset. So, improving neurological recovery and reducing the incidence of disability. We also found an article by Sohita Dhillon titled Alteplase, a review of its use in the management of acute ischemic stroke, and we found that there were only minimal effects of Alteplase if they administered it greater than 4.5 hours after the symptoms. So for max benefits, it's good to have it in that less than 4.5 hours window. So to administer it, it's prescribed by a doctor in a hospital, acute stroke units, ICU, or in emergency units, and it's administered by IV. The dosages, the normal dose is 0.9 milligrams per kilogram infused over 60 minutes via the IV, and its mechanism of action, so since it's a tissue plasminogen activator, it's going to help break down the unwanted blood clots, and it does it by converting the precursor of plasminogen, and plasmin is the enzyme that destroys the blood clots by attacking fibrin, which fibrin is used to form blood clots.
Okay, for the pharmacokinetics of Alteplase, absorption occurs with the onset of a coronary thrombolysis, which occurs in 30 minutes, and it reaches its peak response at 60 minutes, and the peak plasma time being 20 to 40 minutes, with a volume distribution of 27 to 53 liters. The metabolism of the drug, it's rapidly cleared from circulation by the liver, and then it's eliminated. The initial half-life actually occurs in 5 minutes, with the terminal half-life being 72 minutes. And total body clearance occurs at a rate of 34 to 38 milliliters per hour, and it's excreted through the urine. Some adverse drug reactions of Alteplase. The number one adverse drug reaction is bleeding, and this includes both internal and surface bleeding, with surface bleeding occurring most often at the puncture site. Other adverse drug reactions include an accelerated idioventricular rhythm, pulmonary edema, arterial embolism, bruising, deep vein thrombosis, hypotension, pulmonary embolism, fever, chills, nausea, vomiting, or even shock. Sorry, you can do it.
Okay. Sorry. Monitoring. So it's critical to monitor in the first 24 hours after administering. Administering Alteplase. Since it's in the acute setting, they should monitor that. So close observation and frequent monitoring of the patients for any neurological changes and signs and symptoms of intracranial hemorrhaging, and any signs of adverse drug reactions are important for patient recovery. So while Alteplase is being administered, a neurological assessment and blood pressure assessment should be done every 15 minutes, and all body secretions should be tested for any major or minor bleeding. After the drug has been administered, you should continue to monitor for any neurological deterioration in blood pressure every 15 minutes for the first hour after the infusion is stopped, and then every half hour for the next 6 hours, and then every hour until 24 hours after the infusion has stopped. They should also continue to check for any major or minor bleeding and follow up with a CT or an MRI. They should be ordered for 24 hours after admin of the drug before beginning any antiplatelet agents.
And then for any precautions or contraindications for Alteplase, it should not be used if the patient has any is allergic to any of the ingredients in Alteplase, if they have an active internal bleed or a history of a recent stroke, a recent brain or spinal injury that has occurred in the previous 3 months, if they have a growth in the brain, abnormal formation of blood vessels, or a certain type of bulging blood vessel or an aneurysm, current intracranial or subarachnoid hemorrhage. That's contraindications for using Alteplase. And then some special considerations. There is a risk of causing a stroke, and that could actually outweigh the benefits of using the drug. You should avoid any intramuscular, interjugular, or subclavian vein punctures when administering the drug. And just some implications for the drug that we will use as PTs. We will probably not be working directly with a patient who is receiving Alteplase at the time. However, we might work with a patient after they have received the drug, so it's important to know the terminal half-life of the drug so we know after the patient has received the drug how long it's going to be in their system and when the best time is to begin therapy. Also, if we're working with a patient and we notice that they've received Alteplase recently, we might want to be monitoring for any of those neurological deterioration, blood pressure, and any bleeding while we're doing the therapy session. And we could not find any complementary drug therapy. However, we did find that Alteplase should not be given to a patient who is on warfarin.